Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Hello, everyone, and we're glad you can attend Attitude's weekly ADHD Experts webinar. Just an introductory note before we get started. If you've listened to one of our webinars before, you know we offer attendees a certificate of attendance. When the webinar ends, a post-event survey will pop up. It will list 3 questions about the quality of the webinar, followed by 3 questions titled, Required for Certificate. If you would like a certificate of attendance emailed to you, you should answer those 3 questions. If you don't want a certificate, you don't have to answer them. I'd also like to say that today's webinar sponsor is Accentrate, a dietary supplement that is specifically formulated to address the nutritional deficiencies known to be associated with ADHD. For more information, go to www.accentrate.com. And just so you know, Attitude webinar sponsors have no role in the selection of the expert's presentation, or any other aspect of the webinar production. Now, today's webinar presentation will address how to manage social challenges that come along with an ADHD or autism diagnosis. ADHD is marked by inattention, hyperactivity, and impulsivity, which can all affect the dynamics of social interaction. Children with autism, on the other hand, do not intuitively understand some aspects of the social world. Their social development is delayed. While the primary components of ADHD and ASD are different, there is some overlap in symptoms. The trick to differentiating between the two is determine which executive function or developmental building block is not working as well as it could or is missing. We are very happy to have Dr. Bertin here today to talk about the differences and similarities in social skills challenges between the 2 diagnoses, and to provide specific advice about how to address each set of challenges. Dr. Bertin is a developmental pediatrician in Pleasantville, New York. He is author of How Children Thrive and Mindful Parenting for ADHD. Both books integrate mindfulness into evidence-based pediatric care. He is an assistant professor of pediatrics at New York Medical College and on the faculty of the Windward Teacher Training Institute. You can reach Dr. Bertin at his website, www.developmentaldoctor.com. You can ask questions of Dr. Bertin at any time during the webinar. We will try to get to as many of them as we can after his presentation. To download the presentation slides of this webinar, click the drop-down menu labeled Event Resources on the bottom left of your screen. If you do not see the Event Resources tab, you need to refresh the page. So now finally, after all this housekeeping, let me turn it over to Dr. Bertin. Thanks for being here today.
Thanks so much for the opportunity. I appreciate being here today. And thank you, everyone, for joining and everyone who's watching the recording as well. What I'd like to do to start is just go over some of the basics of autism versus ADHD, although some of you may have seen I did a webinar for Attitude within the last year or so that looked more into the clinical side of things, and then focus a little bit on an overview of all the different things that can actually impact social challenges with autism or with ADHD, some of which are direct interventions, and some, as you'll see, might be more general. But we'll get to that in just a moment. Clearly, if we're going to tailor the interventions when someone's having social difficulties, one of the starting concepts is just understanding what is the kind of root challenge going on as best as possible. So when it comes to the challenges that go on with autism and ADHD, it can be useful to academically, at least, although in real life it's not so cleanly separated, look at what is it that a child with autism might be struggling with, and what is it that a child with ADHD might be struggling with, although clearly many children have symptoms of both. So when it comes to autism, I usually think that the simplest way to understand autism, not a simple topic, but the simplest way to understand the diagnosis is that for most children, Social development happens intuitively. Children don't need to be taught how to read facial expression, how to interact with people, how to interact with their children, how to initiate play, how to engage in conversation. All of these things generally happen intuitively in childhood. And when it comes to autism, whether you're talking about someone who's way on the severe end of the spectrum and can be almost seemingly disconnected from people around them entirely. That's thankfully relatively rare to be that severely impaired. To the mild end of the autism spectrum, where you have children who actually can be quite outgoing, but just don't understand social, just the nuances of social engagement. That lack of intuitive understanding, that lack of intuitive development is kind of the core of the diagnosis. And in the latest diagnostic manual, we only really use the term autism or autistic spectrum disorder and have moved past using terms like Asperger's or PDD. What we're really encouraged to do now is to just describe things more individually, just as is someone with mild impairments and where are the impairments versus someone with more severe impairments. So when it comes to looking for whether someone has autism, we're looking for markers of social and play development. Many of those are apparent even by the time a child's 1 year old, so that children, by the time they're one, are often already quite socially engaged. They're doing things like engaging in back and forth play, even like, you make a raspberry, they make a raspberry, peekaboo, things like that show early markers of social development. In some academic studies, they've seen social differences in children who are later diagnosed with autism all the way back to about 6 weeks of age. And though that's part of the group of studies that really prove that autism is a developmental condition, it's a genetically programmed disorder. It's not something we cause as a society or parents. So to diagnose autism, you're looking for social and play delays as the core presenting symptom. The second part of diagnosing autism, which clearly has implications in terms of the interventions we can fall back on, are delays in language and communication skills. And like a lot of autism, those can be severe, where someone is almost nonverbal. And then at the far end are very mild delays, often called pragmatic language delays. And in fact, there is a diagnosis now that you can have separate from autism called a pragmatic communication disorder. And the term pragmatics refers to all the nonverbal parts of communication, all of reading faces, reading situations, gesture language, everything that's intuitive, humor, sometimes empathy is part of it. All of these things fall under the umbrella of pragmatics. And there's such nuances to it. Pragmatics include just situational language, the fact that if I'm giving a talk like this to adults versus children versus colleagues, there might be a different language I have to use to communicating skillfully. And then the third part of diagnosing autism are behavioral challenges or repetitive behaviors. So that's kind of shorthanded on this slide, but it can be obsessive interests. It can be repetitive behaviors. It can be manneristic behaviors, stereotypic things you may have heard of, like hand flapping. And for the purpose of this talk, use the term behavioral challenges more just because we're looking at how some of these behaviors can be a piece of what's causing disruption socially. Of course, children with ADHD often have difficulties socially as well. And when it comes to ADHD, I think the really most practical way to understand ADHD is to not even think of it as an attention disorder. It's really a disorder in a much bigger skill set called executive function, which are all of our self-management skills. So executive function starts with attention, includes an aspect clearly of behavioral inhibition, behavioral monitoring like impulse control, but also includes keeping track of information in your head, like working memory and time management. Really, as a parent, if you want to shorthand it, executive function involves almost anything in life that requires management. You have to manage emotions, you have to manage social situations, you certainly have to manage a classroom situation. So ADHD isn't really in any way a school-based disorder. Well, that's the wrong way to say it. Excuse me. It isn't primarily a school-based disorder. It shouldn't be put in the box of a school problem because it really impacts all these broader skills in life as well. So children with ADHD have social difficulties, but it's for a subtly different reason. In essence, when you look at ADHD, it can come back, and social situations, it can come back to Russell Barkley's quote from years ago that ADHD isn't primarily a disorder of not knowing what to do. It's a disorder of not doing what you know, meaning that in theory, at least, children with ADHD, if we can get them past their ADHD, they do intuitively understand social situations, even if it totally doesn't look that way. So you can look at a moment of impulsiveness as just a moment of loss of inhibition. You know, we all probably have moments in the average week where there's something we really want and there's no appropriate way to get it, so we stop ourselves. And if you don't have that impulse control on the playground, you're just going to just do something to get what you wanted in that moment. One of the confusing things with ADHD is that kids aren't always so skilled at sort of managing a situation once they mess up, so that the follow-up behavior isn't necessarily show remorse or to apologize. It's to sort of emotionally implode or cover up or do all sorts of other things. And that can come across as someone who isn't showing empathy or doesn't really understand things socially. And really all of it can come down to, for children with ADHD, just a moment of impulsiveness and not knowing how to manage the aftermath. So when it comes to the social aspects of ADHD, we have one part of it that has to do with just purely the behavioral component of it. That can have many layers. As you get older, play becomes very focused, we need to hold in mind these ideas and stick to them for a while and not get distracted with the group as a whole are all pretending we're, astronauts for a little while. And if you don't have the impulse control and focus to stick with that, that's going to cause social problems. Impulsive behavior can cause social problems. The older children get, really all the way down to elementary school, they start to expect certain behaviors from peers. So separate from misbehavior, there's just the ability to stick with play in a similar way as your peers. Executive function difficulties, just like in a classroom, can start to impact your play as well. Because executive function is how we hold information in mind, how we think flexibly, how we manage things emotionally when they get challenging. So when children have executive function difficulties, that's going to impact play also. And then there is a small body of research, and there are some studies really suggesting that presumably because of these first two categories, ADHD actually can affect communication as well. So one way to look at it is when you go back to the basic ADHD symptom checklist, which most of us listening, or many of you listening, are probably familiar with. Many of the core ADHD symptoms, even before you start talking about executive function, relate to communication. Overly talkative, interrupting too much, distractible, impulsive. All these things directly get in the way of just routine communication. And then the second level of executive function that often affects communication the second effect of ADHD that often affects communication is executive function, because that's actually really the processing center of the brain in many ways. It's the area we hold on to language, we use information, we access what we know, we coordinate it, we get it back out again. And Dr. Tanner and others up in Toronto have done research, or did research years ago, showing that children with ADHD struggle directly with communication sometimes. And sometimes it's just a pacing issue, like the conversation is moving along quicker than they're following, all of which also is going to impact them socially. So broadly speaking, as we transition into actually doing something about this, what we're really saying is if you're looking at autism, you're looking at social development and pragmatics. And if you're looking at ADHD, you're looking at behavior and executive function. And then many kids have symptoms of both. So really, in many ways, as we go into intervention for behavior and social skills, which is sometimes inherently very dissatisfying, really quite often it's the intervention that matters almost more than the diagnosis. It's interesting, I think, from a research point of view, perhaps to study some of this, and as a parent, it may be practical to kind of do the exercise of trying to tease out which is which, but for many kids, it's not so clear which is which. And quite often, it's more about, as we're about to talk through, looking at what interventions are possible, what makes sense in any particular moment of time, trying it out, reevaluating. Quite often, the intervention itself is a useful way of gathering information and sorting out, like, what is, now that we've done a little bit of this intervention, what really does seem to be going on here. But you can't always know with 100% certainty, why a younger child is struggling with different aspects of their social world. So the foundational intervention, which is probably something many of you are aware of, is just recognizing that behavioral therapy itself, which is can be quite labor intensive, quite expensive in certain situations, really challenging for family logistics. It is not that easy to get behavioral interventions in place fully. And yet, behavioral therapy is the primary tool set we have to try to teach kids, either with autism or with ADHD, how to learn new social skills, in essence. And there's multiple threads to it. There are multiple different options, but this is really the foundation. So certainly for autism, the way I typically picture interventions and the way you're going to help someone begin to develop new social skills is almost as a pyramid, where the foundation of most proven intervention for autism of any severity is behavioral therapy, kind of as much as tolerated almost. And that is, from an educational planning point of view, kind of inherently part of the situation for most kids if they have really severe autism. And yet there's some research suggesting that when kids have mild high functioning autism, there even are some of them who outgrow that label at some point. But the only predictable factor, the only controllable factor that goes into whether or not they're going to outgrow it is continuing behavioral therapy even when they have mild symptoms. And that's actually can be quite challenging, because the subtler their symptoms become, they might be really busy with lots of after-school activities, and their school might not want to do it anymore because they're doing fine in the classroom, and they might resist it because they don't want to be labeled, and all these different things may happen. And yet we need to recognize that in a behavioral field, behavioral interventions are part of evidence-based care. So this is part of the long-term intervention for autism that really we want to persist with for most children almost indefinitely. And there's social skills-based programs. There can be working on the obsessiveness or anxiety that goes along with autism for some children. There can be, different ways to use it, but that's the foundational intervention for autism. And then I'm jumping ahead a slide, but since I talked about the pyramid, the second piece of that pyramid, which we'll get to soon, is the speech language piece. It's recognizing again that even in mild autism, social pragmatics, communication pragmatics are often impacted. And really, that is the core of intervention for autism right there in a nutshell. Everything else, the sensory issues, the occupational therapy, maybe physical therapy they need, whatever. There's all sorts of other things, mindfulness, all sorts of other things we can talk about that can help. But the foundation are those two pieces. Now, when it comes to ADHD, again, when we look at ADHD as a self-regulatory disorder, a self-management disorder, certainly today's not one, we're not talking, today's not about the medication interventions for ADHD in particular, although I'll touch on them. The core of it to recognize is that much of intervening for kids with ADHD are teaching them skills that aren't coming intuitively also, a lot of self-management skills. So when you look at helping children learn how to manage social situations, some of it just has to be instructional. That's the best way to think of well-done behavioral therapy, is it's instructional. This is the toolkit we have. What's nuanced about some of this sometimes is recognizing that, especially as children get younger, parent training is often almost more effective than individual therapy, depending on the types of issues going on. That's true of all children. I mean, one way I sometimes joke about it in the practice is for the average young child in therapy, they're probably, by the time they hit the parking lot, have already forgotten half of what went on in the therapy, if not more. But the grown-ups in the room, if they're part of the intervention, can stick to a plan for an extended period of time, adapt it, expand it, add parts to it. So parent training is another approach to behavioral therapy that can be quite effective in the short run. It's often, in parallel to a child's own work, in essence. So a child working on different issues related to ADHD, like managing their emotions or following routines better, in the long run is clearly going to have a big benefit. In the short run, may not have as much benefit as if a parent gets involved. You can even look as subtle as the emotional part. Well, it's not subtle experience, but subtle in terms of behavioral intervention as the emotional part of ADHD. So like many, many kids with ADHD and autism have a huge problem with difficulty with emotional reactivity. And even when, in the long run, those children are going to benefit if they learn to manage their own emotions more skillfully. In the short run, so much of early childhood learning is simply a behavior happens, and the very next thing that happens either encourages more of it or discourages it. that's like the core of behavioral intervention in young kids, that model even applies to emotion. The message that you can get angry, you can get frustrated, but we're going to reward you when you do this when you're frustrated, and we're going to have a consequence when you do this when you're frustrated. Or even when you're anxious, we want you to remember to follow this new technique your therapist has introduced. All of those things are supported by parents. So when you talk about supporting kids socially with ADHD or autism, it might not be first thing on the table. It might not be the first thing you think about. And yet parent training, different parent programs, discipline are all ways we can support children. Or another nuanced thing that comes up sometimes, I think quite often many of us as parents, hopefully, are really flexible with our kids. We're trying to, give them a break at home and let them, be themselves almost. And we're trying to choose our battles. And that's absolutely appropriate. And yet sometimes that allows, a child to get into a situation maybe where, we have to ask ourselves, we have to, ask them to do something 5, 6, 7 times before they respond. So we've just gotten into that routine at home. But clearly, that one thing, which may be a great initial solution to a child who needs a lot of repetition, if we have the bandwidth for it, if things are generally going well, it can be quite valuable to, as a parent, just start working on getting them to respond on the first try more consistently, because that's going to spill over into their social life. So sort of behavioral work as a parent in that way begins to support kids too. So there's a big umbrella of possible behavioral interventions that could support children with ADHD or autism. Most of the proven ones are more individual interventions, although more and more group social skills groups and group interventions are being used. And that's particularly important in kids with milder impairments, because quite often, one thing I haven't mentioned yet either, quite often the subtlest social issues in life are only going to come up with peers. Adults, between the routines and limits they can set and flexibility they can show as grown-ups and their ability to sort of reach out across the gap and help you and sort of scaffold your social skills. Children with milder issues often do much better with adults. They have an easier time playing with and interacting with adults. And in order to really have the right situation set up to work on subtler skills, you need other kids in the room. So more and more, there are various group approaches to social skills interventions being used as well, although the science of that isn't quite as proven, like which ones are best. But they're definitely an aspect of care as well. So that really, when it comes to behavioral interventions, you're choosing from all these different interventions. You're deciding in any given moment, and maybe we can get more into this in the Q&A, which one might be most effective. I can choose from parent training. I can have my child work with someone individually. I can look at a group. I can do some mix of these things. But this is kind of the range of behavioral interventions that we want to start with to most directly build social skills in different ways. As I alluded to a few minutes ago, a second piece of intervention, primarily with autism and at times with ADHD, is recognizing that social and speech-language pragmatics are an inherent part, particularly of having autism. And that's, again, the milder symptoms get often dropped, I find, way too early in terms of school planning in particular. It's almost like a logic problem. If you really feel like someone, during a school planning meeting, still meets criteria for a diagnosis of autism, almost by definition, you're saying they have pragmatic language differences. Now, the catch is whether there's anybody in that school setting who has the training to be working with language pragmatics in that way. So you can choose your battles a little bit. But the fundamental starting point is recognizing this is just intrinsic to autism, and that for almost everybody with autism, there's going to be stretches of time where working on the speech language will be helpful. One subtlety that's important to start with quite often is recognizing that, kind of like executive function, language pragmatics are not completely measurable. You can't go just by the numbers. So when it comes to a speech language evaluation, you can look at expressive language, which is kind of your, vocabulary and capacity to form sentences and paragraphs and such. There's receptive language, your understanding of the concrete part of language. And then there are lots of measures of pragmatics out there. But since pragmatics is all just about the nuances of how you're understanding communication, you can certainly meet kids who clearly are having difficulty understanding and navigating their social world from a communication point of view, but you can't quite nail it down in terms of testing. So if you're going just by test scores, you're going to miss it. As a side note, that's completely true of executive function also. Most concrete measures of executive function are almost too specific. Executive function, it's all about just how you're managing day-to-day life. So if you go just by the numbers, you're often going to miss the fact that someone truly is struggling with some aspect of emotional management or time management or organizational planning or some other aspect of executive function. But when I organize my thoughts around trying to get interventions in place around autism or ADHD that deal with your social world, speech language is the second foundation of it. And you can look at it as you can have one of three different types of interventions, or all of them if things are significant enough. There are individual behavioral therapy based interventions. There are individual speech language based interventions. So where you're just one-on-one with someone who's trying to help you learn speech language pragmatics. And then in the middle are these group interventions, which can, again, depending on the situation, you can choose speech language groups that come at things from a more behavioral point of view, maybe are focused on rules and problem solving and things that are very helpful in day-to-day life. And then you can have speech language based group therapy as well. And that's a wonderful intervention for children who often are at the milder end of either having an autistic spectrum disorder, or really there are certainly children who don't meet full criteria for autism. In many ways, you can almost think about this for those of us who are old enough to remember the PDD diagnosis, was sort of that catch-all diagnosis where they weren't meeting full criteria. Quite often now the term pragmatic communication disorder gets used instead. And those are children who just having troubles with the pragmatics without necessarily having, meeting that full criteria for autism. And in those situations, a group is can be quite effective, because in the end, some of these subtleties, you need the other children in the room to sort of bring on the issues that you're going to be working with. I did also want to touch on the fact that when we're looking at ADHD or autism, and we're looking at supporting someone socially, everything really does interrelate. There's no way to fully separate interventions in essence. So that, for example, if you have autism and you're slowly learning skills and maybe you have some new knowledge you're trying to implement, but you have out of control ADHD symptoms so that you're highly distractible and impulsive, you're going to fall into that situation again that I mentioned earlier today of knowing something, but not, the ADHD summary of it's not a disorder of not knowing what to do, but a disorder of not doing what you know. So you have these autism interventions that are starting to take hold, and then you can't quite manage a particular situation. So with ADHD medications, for all the misunderstandings about them, for all the controversies, the bare bones bottom line facts are that they have been around a really long time, close to 100 years, that when they're managed well, most kids can find some benefit with no significant side effects. That's the goal, even though it isn't often talked about that way. And when you're trying to support someone socially and you recognize that ADHD symptoms are often impacting them greatly socially, that ADHD symptoms may be preventing them from accessing this budding social development that they have anyway. They're not, in essence, they're not moving slow enough to access the fact that they kind of do know better. When you look at that whole situation, this is also an important part of care to bring to the picture if someone is continuing to struggle socially. It may be the behavioral interventions in essence need more support, or they need to complement each other. With autism, there are also other layers which we can get. I don't want to get too down the medication path today unless it comes up in the question and answer, because autism often goes along, for example, with obsessive thinking or obsessive interests. And again, the initial intervention always to try to lean on it from my point of view is behavioral therapy. When behavioral therapy fails, if you can help someone get some relief from that obsessiveness, that clearly might help them socially. And in either case, whatever medications we choose to use, if that's a path we choose to go down, it's important to recognize that neither of these conditions affect only a school day. So the goal with the ADHD medications in particular is to cover your whole functional day without side effects, whatever that looks like. And really, this ties into social development and resilience overall in so many subtle ways, because if you're successful in your after-school activities, that's going to change how you feel about yourself. That also, in those after-school activities, might be where you're more likely to connect with other kids. There's some research suggesting that simply having one consistent friendship through childhood is protective. Is just some kids don't even need many, just that one dependable person. And all of these things come together by supporting kids, by any means necessary, in essence, so that when they're at their best, they're more likely to connect socially and make friends with other children. Another aspect of sort of coordinating an overall plan is really looking at how we can help kids support kids socially in the school setting as well. And there's a few subtleties to look at. This, by the way, touches on kind of an overall model. I think that's useful for almost any issue that comes up in child development. If we need to sort of reassess, give ourselves some space as a parent to figure out if we're doing the right thing, sometimes, and it's going to change over time, but periodically we can just look at, okay, from an outside of school family point of view, what services are needed, if any? Parent training, individual therapy, speech language therapy, maybe tutoring if we're talking about academics. We can just look at and just reassure ourselves, like, I got a good plan in place here. And then the second piece, which I'm about to get to, are the educational options. Do we need to do anything about the school plan? Because I think, so many things in child development unfold over long stretches of time. It can be really reassuring as a parent to recognize that, like, things aren't perfect right now, but this plan makes sense. So I need to give it, half a school year or a school year. So it's family-based supports, school-based supports. And then the third piece for many families is just considering, is there anything medical to be doing? And do I have this down? And is this working as well as I need? And if you have all that in place, that may be an opportunity to sort of let go a little bit as a parent in the short run and recognize, even though there's a challenge right now, I have the right system in place. I'm working on everything I need to. So in school, there are a couple of nuances, where a lot of it has to do with advocating for children, looking for different supports, inside the classroom and outside the classroom. One of the things to look at around mild high-functioning autism in particular is when you look at social rules are relatively straightforward during the academic part of your day, so that kids with milder issues often do great in the classroom, and yet the IEP often is pushing an aid into the classroom only. When children having mild social issues, that's far more likely to happen during unstructured time in your day. So during gym and lunch and recess, and often that's where kids need the most direct social support. So you sometimes need to coordinate a social plan that is broader than just classroom time. You can look at 504 type interventions, which are push-in services. IEP is a full special education intervention, because really for most families, as much as we can get in the school setting just takes the burden off of us outside of the school setting. So for children with autism, we can try for the speech language therapy, the social skills groups, and try to get at least some of these interventions in place in school, where the goal is always, I just wanted to end around school and touch on the fact that, we're in a period of time right now in education where, the goal, I think, always for all of us is mainstreaming everybody as soon as possible. That's the least restrictive setting idea. But it is important to remember that intensive interventions young are part of how kids catch up. So certainly, if there is an appropriate setting that for children with autism in particular, that really focuses on social skills throughout the entire day, which still exists in many school districts, even though that's not an ideal situation in the long run, in the short run, there definitely is evidence that more intensive interventions young help children catch up quicker. So you open up options later by considering these alternative settings. Sometimes it really has to be very individual. Some children thrive in a sort of mainstream setting with lots of supports. Other children are going to feel like they're in a more comfortable setting and get more intensive supports in a special education classroom. For example, a program that builds social communication skills all day long while doing everyday academics. So that's a very quick overview of various interventions that are available for children struggling socially. Maybe you can get into some of the specifics during the Q&A. But just to summarize that before moving on to the question and answer, clearly with any intervention we're doing in child development, in medicine, the first step is to try to tease out, when it's possible, what is the fundamental underlying issue here. And for autism, that's social and communication delays. And for ADHD, that's about self-management, although there's a big overlap. Many kids can have signs of both. I think the most important thing is often just focusing on, from a child's point of view, what supports do they need? We don't always know exactly what the trigger of every problematic behavior is, but we do know what interventions are most likely to be effective, and we often learn a lot from the interventions. Certainly, I'm talking primarily about the behavioral interventions right now. So that comes down to, from all the different behavioral interventions that are available, which ones make sense in this moment? Or are all of them needed in this moment? Individual, I don't need to summarize that again. And then speech language is that pragmatic piece, particularly among kids with autism, but often a subtle piece for kids with ADHD as well. The third piece, like I laid out a minute ago, is evaluating with an open mind if medications might be beneficial. And then obviously fine-tuning the school plan. And then, like a lot of things in life, I think really the most important point is being open to adapting and monitoring after that. It's a frustrating part of my field, I think, for a lot of people in general, that there isn't necessarily a yes-no question, a yes-no answer every time. It's about making a plan that makes sense and then really being flexible and monitoring it, because in the end, child development is quite often more like steering a cruise ship than anything acute. For many, many kids, it's about that long-term slow plan of like, this is what makes sense now, and we're going to add this, and this one doesn't seem to be so useful. And as long as we're aware and involved and flexible in our thinking, over a stretch of time, we can typically catch kids up and get them to the point where they really thrive. So I appreciate your attention today. And I want to stop now because I want to leave plenty of time for questions. So thank you all for listening. And I'm curious to hear what comes next.
Thanks, Mark. That was excellent. A lot of questions about therapies, behavioral therapies, people wondering about where ABA or DBT might fit in terms of this.
Sure.
Yeah.
Those are great questions. And those, they're quite different. So, the most studied and proven intervention for autism is typically called ABA, which is applied behavioral analysis. It's sometimes referred to as discrete trial intervention. And the simplest way to think about autism and ABA is that many times children with autism they're not really that motivated initially to be that engaged socially, to play. So traditionally, whether the ABA intervention starts is that it's really driven by adults a lot. We decide that the next skill you need to learn is to go out and greet other children, even though you're not necessarily showing all that much interest in it. And then we break down that task into parts and reinforce it. So it's a very adult-directed, roll up your sleeves and build skills type approach to intervention. And it is certainly far and away the most studied and proven intervention in autism, with recommendations up to 25 to 40 hours of intervention for kids with severe autism. As kids become more extroverted themselves, more self-determined, there are a whole lot of variations on ABA and floor time and all these other interventions, many of which are quite effective, although for the most part not quite as well studied, but often really appropriate and needed as kids show more initiative on their own. So a lot of those therapies, autism-based therapies, then allow children to take the lead, and we're trying to sort of facilitate and build their skills from that point. DBT, on the other hand, is more related to cognitive behavioral therapy. So cognitive behavioral therapy is typically the most proven, the most recommended intervention specifically for ADHD, anxiety. It's sort of a very practical approach. It's different than psychotherapy, really looking at what's the trigger of a particular situation? How can we learn to manage that situation differently? And in essence, what DBT adds is it's more or less for today. The shorthand of it is DBT is more or less mindfulness, a version of mindfulness-based cognitive behavioral therapy. So we're integrating various skills having to do with self-awareness and the broader practice of mindfulness into cognitive behavioral therapy. So again, that's part of individualizing therapy, because many kids with autism at times do benefit from CBT, which is a more, CBT addressing things like anxiety, for example, or obsessiveness. So that's the difference between ABA and DBT.
Okay. What about the potential differences in social skill challenges between boys and girls diagnosed with autism or ADHD? If you could tease out the differences in each, or
I think it may be more practical than looking at it as gender specific than really just trying to individualize it, based on an individual's challenges, because
right.
Kids are more, boys may be more likely to have some of the more externalizing symptoms of ADHD, and girls may be more likely to have the the inattentive symptoms, which on their own, when you look at work like from Pat Quinn, who had a great book, Understanding Girls with ADHD, the inattentive type of ADHD quite often is linked with social stresses. And yet it isn't really gender specific as much as symptom specific. So that, while it's generally true that, girls are more likely to have the inattentive type, it's more important even for a boy with a boy could just as well have that same pattern. So I think it's less about gender specificity as much as just individualizing and trying to understand, the struggles of whoever you're working with.
A very practical question. How do you find a very good, solid, evidence-based behavior program and therapist? Are there any websites or approaches you would take to find those?
Yeah, that's a great question. I think one of the hardest ones for many people. I mean, even for many families starts with a much more basic question and a really challenging one, which is just in-network versus out-of-network care. I mean, often many people, this is something you're often committing to doing for quite a long stretch of time. Most people have at least some mental health coverage nowadays. In some states, like in New York State, there's even an Autism Family Act that allows behavioral therapy to be covered under your medical insurance. So there is the balance of sometimes from a realistic point of view, you need to focus a bit on just what's practical as a family. Then, moving out from there, I think there are, certainly there's, if you're working with someone like a developmental pediatrician, that's often part of what they do. I think your local special ed PTA, your local SEPTA often is a great resource group. Your pediatrician often is another great resource to fall back on. There are places like Attitude Online that have, lists of providers. And then there are often in some communities, many communities, there are specific autism support groups. Like around near me, there is something called the Autism Family Center that provides exactly that service. Although I think there's a subtlety to it that's also worth looking at, which is I think in working with anybody in behavioral health, I often feel like it's about 50% finding someone who's really clinically good and about 50% just finding someone you connect with individually. Like it doesn't matter how good clinically they are. If you're going to be, hanging out, learning from them and working with them for a long stretch of time, it can't just be the, recommendation that they happen to be good. It just, it has to be someone you're also comfortable with individually, as a family.
Right. I don't know. I guess there's been about 6 questions about, here's a typical example. My 15-year-old son, who is diagnosed with borderline ASD and ADHD, refuses to go to social skills training class for teens. He is defiant with me, and I kind of make him do anything he doesn't want to do. How can I get him to change his mind? I know that's a tough one.
It is a really tough one. I think working with teens, clearly is teens are teens, with or without developmental differences. It's a stage that they're going through that can often be quite challenging. And I think there's 2 or 3, general approaches that are important to keep in mind. And, one of them is as teens become teens, certainly we aim for more collaboration. So I think whoever is asking those questions, I'm sure you've tried that. But at the same time, we have to realize that teens by nature, and certainly teens with ADHD and autism, are often behind in their own sort of self-advocacy and planning and judgment skills. So what that means is, in spite of their age, we often need to kind of fold in old school behavioral management too, as challenging as it is. So what that can mean is kind of top-down decision-making, which you're already doing, meaning like we decide what's the range of what's appropriate in this situation. And then you have to look for, I guess that's what I'm getting at is that, you discuss and get as far as you can with discussion and collaboration. And then sometimes there just needs to be, a behavioral approach, a behavioral intervention almost. Like, Russell Barkley has written books, other people have written books on behavioral interventions for teens. Because in the end, sometimes it just needs to be that balance of, we're going to try to negotiate a way to get you there. And then you also have to behave appropriately to your parents. So using reward systems, using, some consequences. It's often called a token economy in teens is quite important. And then on a foundational level, there's a wonderful book by Wendy Mogul called The Blessing of a B-, which raises some just a general overview of raising teens with some more specific advice mixed in. And one of my favorite pieces is a concept called, she calls something like putting money in the bank, which is basically to say that, there are going to be times we bang up against our teens and have to set rules when they don't want them. And since that's the case, we really, really want to emphasize whenever possible positive time together and things we enjoy together and, and finding value in whatever they enjoy. And just basically that's where she goes, just like putting money in the bank, building overall positive relationships so that we have something to draw on when things go south for a stretch of time. Mm-hmm. And I think that's very important too. And then the last thing I would say about it is that because part of typical teen development is that they are supposed to be separating from their parents, but if they have ADHD or autism, they actually may be delayed directly in the skills that would allow them to do that. One of the negotiations to bridge, one of the things that can be helpful are looking for somebody to sort of take on that role outside the family, either because, the group is more of a group of, presented more as a group of peers, or more concretely, one of the negotiations I sometimes am able to manage is talking to a teen and sort of saying like, look, if you can work with this person, consider them your advocate. If you guys can work on this, your parents are going to be able to back off. You both win. So it's almost like a contract you negotiate, which isn't to say, parents are doing anything wrong. It's just what all teens want. So you sort of get them to buy in by seeing it from a teen's point of view. By committing to this, I'll be able to step, I promise I'll step back too. And then obviously seeing how it actually goes in real life. But I do think it's important to, find that balance of letting teens be teens and trying to, collaborate when it's possible. And then at times it's going to come down to reward and rule setting, just like any other age group.
The author again, can you mention Wendy? Could you just spell her last name?
Wendy's last name is Mogel, Wendy Mogul.
Okay.
And she wrote a book called The Blessing of a B-. One thing for anybody to know who looks into that book is Wendy's known because she actually pulls from Jewish teachings in the book, but it's not, she teaches at churches and stuff. It's not particularly a religious book. It's just the framework she uses sometimes.
Mm-hmm. Several people want more details on pragmatics. You mentioned it as a second tier of intervention, according to this one person, and they want to give examples or how it works.
As an it actually is one of the more nuanced and from an intervention point of view, least defined point of view of how that intervention should happen. But what pragmatics are, again, is just to summarize, are the kind of all the unspoken intuitive parts of communication. So it's pointing and gesturing and facial expression and reading tone of voice and having an appropriate tone of voice, for example, because, part of what you're looking for when you're trying to evaluate autism early on, for example, is unusual tone and tone of voice and inflection. So pragmatics are all of the more nuanced parts of all the communication skills we all need to use. So the interventions, it really depends on which aspect of pragmatics you're talking about. If it's something as concrete as eye contact, then you can almost just reinforce and try to develop it as a behavioral intervention, more or less, by, just encouraging it verbally and rewarding it in subtle ways and praising it when it happens, whatever a behavioral intervention might look like. The nuances of pragmatics are really hard to teach. And the research is actually a little ambiguous about whether the programs themselves generalize all that well outside of the programs, but often those are programs that are like social stories, where you're putting kids in different situations through the intervention and helping them problem solve, and trying to teach them through these either stories that they read or situations you create in a group. Teach them to try to take someone else's point of view or to problem solve flexibly. So the programs are often based around that kind of creating situations, talking kids through them, helping them problem solve from a more concrete cognitive point of view, with the hope that eventually those skills are going to generalize into the real world. And that's where I think I would say personally, the programs do seem to work quite often, even though at this point in time the research isn't always as clear, because generalization is always the hardest last step. Kids often get to the point where they can handle things well within the group, but it hasn't quite generalized to the playground. And that's, those are the nuances of all this. I don't think anyone has totally defined how to best do that last step.
Mm-hmm. This is, I was wondering this myself. Can a child who's beginning on medication for ADHD become more shy socially rather than less? Have you run into that, or?
Well, I think that's one of the nuances of medication that can be really hard to explore sometimes, because you're almost looking at benefits versus side effects that can be really subtle. So when you look at, I think one of the examples I sometimes use is like when you look at college kids who start treating, and this will come back more specifically if this is a younger child. You look at college kids sometimes who go on ADHD medication. What I found is some of them will say that they feel quieter, happier, and more under control, but their friends are kind of saying they're not as much fun at the parties anymore. And so that for some people with ADHD, there are symptoms of ADHD that have to do with kind of being the class clown and overexcitable, and you're kind of you're living out beyond your own comfort level sometimes. So that for those people, when you treat their ADHD, when they're old enough to talk about it, they might tell you that, actually, I feel great. I'm just quieter, and this is more how I'm comfortable. On the other hand, one of the medication side effects you have to watch for while you treat with ADHD is the wrong medication or too much of a medication can make someone feel withdrawn. And that's a side effect of the medication. And that is someone who typically would say they feel a little blunted and not as happy. Although in younger kids, it can be pretty subtle. So the answer is absolutely. You can see kids who, once they're settled, are quieter and less extroverted socially. The exploration is at that point, is that because, they're kind of happy and this is more, this is like they're comfortable with that, or whether, when you really look at it, you're causing a problem because you're making them, more withdrawn than they would naturally be. And there isn't, the only real answer is trying different, often just trying different medications and comparing on medication to off medication until you have a clearer sense about, what's going on exactly.
Right. And this one, I don't want to tie you up with too long a question, but one parent is actually asking, I'm fascinated with language therapy. Frankly, I've never heard of this approach. Can you please expand on this? So maybe that could be your last answer.
Well, speech language therapy is its own field, so I don't know that it has to be a very long answer because it's its own, it wouldn't be fair to try to summarize an entire field, but, what a speech language therapist is trained in, you could start, it may be easier to understand when you start with the most concrete things. So if you have a child who just is delayed in purely expressive language, forget the nuances of pragmatics. We've all probably had family members or known kids who just spoke late. So part of what a speech language therapist is trained to do is just help those kids through the interventions they're doing, learn more skills. And then, some speech language therapists have a specialty dealing with some of the more oral motor difficulties that some kids have, which again doesn't relate to autism or ADHD specifically, just sort of illustrating the field. So,
Right.
Just like any other specialty, what a speech language therapist does primarily is they have this background in helping cultivate language skills wherever they're behind. Many of them have their own niche or specialty they've studied most, like many of us do, in each of our professions, so that when you look at this very, nuanced and complicated umbrella of skills that go into language pragmatics, that is its own training program in essence. There are people who are just, that is the intervention they've learned how to do. So it's a little, it wouldn't be fair to them to try to give it a,
Right.
What it does is it looks as pragmatics as a series of specific skills that you can develop, and then tries to programmatically teach them to children so that they can, become more intuitive in catching those sort of subtle aspects of human interaction.
Right. Things like maybe starting a conversation with a friend?
Yeah,
Would it be
absolutely. Pragmatics include all of that. It's about how do you start a conversation, and how do you read a conversation and read a facial expression and take turns in a conversation. How do you speak to a teacher differently than you speak to a peer? What kind of sense of humor is okay with another 9-year-old versus with, the principal of your school.
Right.
Maybe how to read a social situation like I talked about, or read or handle a complicated social, a complicated social problem.
Right.
All of that falls under pragmatics, so that if you find a strong, speech language therapist who's trained well in it, they need to get to know your child and hang out with them enough so that they can find those opportunities to say, like, okay, and just, this is what I think is going on in this moment, and then try to teach it, just like you would try to teach any other skill in life.
Right. Okay. Well, the hour is close to up. That was great. You gave us lots of practical strategies and information. And thanks so much for being here. We'll have to have you back again.
I always appreciate the opportunity to be here. And hopefully we'll have a chance again sometime.
Yeah,
so take care,
we will.
All right. Thanks. Take care.
Thanks.
Bye, everyone.
And thanks to all of the attendees for being here. Once again, today's webinar sponsor is Accentrate, a dietary supplement that is specifically formulated to address the nutritional deficiencies known to be associated with ADHD. For more information, go to www.accentrate.com. And next week, Randy Coleman and James Daly will address screen addiction in kids with ADHD and how parents can get a healthy grip on their children's screen time. So thanks for attending today's webinar, everyone, and have a great day.
For more Attitude Podcast and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com. That's ADDITUDEMAG.com. That's ADDITUDEMAG.com.